Good day, it's me, Carla. I'm a medical student, and for today's video, I'm going to perform the male urinary catheterization. So what is urinary catheterization? So urinary catheterization is a process in which the catheter is inserted into the bladder to collect or drain the urine. So first thing we're gonna do, we need to make sure to check the physician's order, and next is we're going to gather all the things that are needed. So I have here the water, soap, and the washcloth to clean the area, the perineal area, alcohol to sanitize your hands, a syringe, 10cc syringe, the iodine, the two-way Foley catheter, the drainage bag, the phenicited drape, the gloves, the lubricant, the cotton pads, the cotton balls, the underpad, also I have a plaster and a picking forceps. Also, verify the client's identity, explain the procedure to them, and provides the client's privacy. Also, don't forget to perform the hand hygiene. Hello sir, good morning. I am Carla, your student nurse. So sir, can you state your name and your birthday? Okay, so Mr. Johnson's, I understand that you have difficulty in urinating. So the doctors ordered me to insert the catheter. So the procedure that I am going to do is to insert the tube on your urethra and connect it to your bladder so that you can excrete your urine. So is it okay with you, sir? Okay, so position the patient in a supine position with the legs extended and slightly apart. Okay, sir, kindly lay down. Okay, so after positioning the patient, perform hand hygiene and wear your gloves before cleaning the perineal area with the soap and the water. So we're going to wear our gloves. Okay, so now we're going to wash the perineal area with the soap and water. Okay, so we're going to wash with circular motion. And then we're going to rinse. And path dry. After cleansing the perineal area, you need to remove the gloves and perform hand hygiene again. During the insertion, we need to open first the catheterization kit. So, we're going to open like this tip. And we're going to get the gloves. Then we're going to put our gloves and drape the patient. So we're going to use the underpad. So we're going to ask our patient to raise his hips so that we can put the underpad under the penis. And then we're going to use the fenestrated drape. And we're going to put over the penis. Prepare the antiseptic solution with the iodine and the cotton balls. Next thing we're going to do is to attach the saline-filled syringe to the side port of the catheter and inflate the balloon. And we're going to inflate the balloon. So the balloon inflate. After that, we need to deflate the balloon and leave the syringe connected to the Apply a sterile lubricant to the first 6 to 7 inches and 15 to 7.5 cm of the catheter to the drainage system and ensure that the drainage bag emptying port is clogged. So we're going to put the lubricant. And gonna put the drainage bag. Then bring the key to the sterile field between the patient's legs. Then we need to proceed in urethral meiosis preparation. With non-dominant hand, gently grabs the shaft of the penis just below the glands. So keep your head in place as it's now contaminated. If uncircumcised, use the same hand to retract the foreskin. Next, with the sterile dominant hand, clean the meiosis with antiseptic solution. So we're going to use the iodine and the cotton balls. And then we're going to wipe outward and in a circular motion. Outward in a circular motion to the base of the glands. So do this 3 times. Then dispose the use and do it again in a circular motion. Dispose and last in a circular motion. Then, in catheter insertion, lift penis with non-dominant hand perpendicular to the patient's body, pull up slightly on shaft, and gently press the both sides to help open the meiosis. Okay, so take a deep breath, sir. 1, 2, 3. Then you need to ask the patient to bear down with sterile dominant hand, slowly insert catheter through urethral meiosis until urine flows. Then advance the catheter into 1 inch more. So do not force the catheter through the urethra. While inserting it, ask the patient to take a slow deep breath until the initial discomfort has passed. Okay, sir. Take a deep breath. Next is to hold the catheter with the non-dominant hand using the sterile dominant hand to fully inflate the catheter of the balloon. Now we're going to remove our syringe. So after, gently pull the catheter until resistance is felt. Then secure catheter on the patient's outer thigh in the lower abdomen with a securement device like strap or a plaster. So we're going to cut a plaster. Put it in here. Also, you need to ensure that the tubbing is not kinked and secure the drainage bag to the bed frame below bladder level. So, but not resting on the floor. After the procedure, you need to dispose the used supplies. So, place the syringe in a sharp container. Then we're going to remove our gloves. After that is we're going to remove our gloves and perform hand hygiene. Then we're going to put our patient in a comfortable position. Okay, sir, do you feel comfortable? Do you want a blanket? Okay. Okay, is it good now, sir? Okay. If you need something, call me, okay? Thank you. Next is documenting the type and the size of the catheter and balloon, amount of the fluid inserted in the balloon, patient's reaction to the procedures, amount of characteristic of urine, name of person performing the insertion, and the time and date it was completed. Okay, thank you. That would be all. Thank you.